Hello, future nurses. Morgan here from Archer, and today I want to walk you through our free nursing school starter kit. I personally know nursing school can feel like you are just stepping onto a roller coaster that is already in motion between like the class, the clinical, a million things to memorize. I felt really anxious, and I know a lot of you do too. That is totally normal. So sharing my top tips and tricks in this starter kit. I'm basically just going to walk through each page and show you how to use it to really get the most value. Let's dive in. Okay, your first two pages here are a weekly study calendar. Now, I love like a fancy notebook agenda, but for me, it's actually way more important to get the format right so that it works for my brain. So I always liked where we had like a planner style situation on the left where you could actually see and list out day by day exactly what you needed to do. And then over on the right, a little bit bigger picture, look at the entire week and your priorities. And priorities are always where I start. So in that top right, top three priorities, maybe it's you have a test that week, an assignment that's due, maybe it's a clinical rotation, whatever those top three non-negotiables are. Then I like to actually list out all of my major and minor assignments as well as my clinicals. That puts it front and center, and it's my starting point to make sure I don't forget anything. I do this on Sunday night for the upcoming week, by the way. After I've taken care of those two things, I go over to the left page and I start making a plan. And I use backwards planning. So I've already identified, hey, this is what I have to do this week. I work backwards from there and fill in what has to happen so I accomplish it. So let's say I had a test on Thursday in MedSurg. Starting out on Monday, I need to study Module 1. On Tuesday, I need to make flashcards for Module 2. Whatever it is, very specific checkbox tasks. How am I going to accomplish those big things I already wrote down? When you start with the end in mind like that and work backwards, you are way more likely to stay on track because you've created small, actionable tasks that will set you up for success throughout the week. And then you get the satisfaction of checking them off on your list as you go along. So then once the week has passed, I do like to take just 5 quick minutes to reflect on what I accomplished and what's coming up for the next week. So again, I do this on Sunday nights. I wrap up at the bottom part of that right page, flip the page, and then go right into the next week. That keeps me motivated, accountable, and on track throughout the week. All right, next page, we have this great packing checklist. I broke it down into your study supplies, things you need tech-wise, as well as for clinicals. That's where I was the most stressed. So the most important things are a good quality stethoscope. Actually try it out before you buy it. I love having my foldable clipboard because I can take my notes during clinical, but also keep it in my pocket. It doesn't take up as much room. You definitely need a watch with a second hand. That's going to be super necessary for checking pulse and blood pressure, and then a pen light to check pupils. I always wear compression socks, especially if you're going for a 12-hour clinical shift. If it's only a half day, maybe less necessary, but really important in my opinion for those 12-hour days. And then most nurses will have their own bandage scissors, or some people call those trauma shears. So depending on where you're going to clinical, perhaps grab a pair of those as well. So then on page 4 and 5 here, we have a guide about using study tools during nursing school. So essentially we want you following a 3-step process. We want you watching or participating in content. So doing video lectures, flashcards, learning your actual content. Then in step 2, you need to do practice questions to assess your knowledge level. And lastly, the most important thing to do is remediate. So finding a tool that helps you pull out, hey, these are my weak areas. For me, it was always neuro. I couldn't figure out the brain stuff. Cardiac worked a lot better for me, but I needed to remediate the neuro content. So finding a study tool that's going to pull that out and help with a remediation plan so that you improve in those weak areas before test day. So these pages give you a little bit of a breakdown about exactly how to do that. Our next 3 pages are some of my favorite. We have first some mindset and wellness tips specific to nursing students, as well as nursing school advice. We went around and asked experienced nurses, hey, what do you wish you knew on that first day? And we got some really nice advice pulled into these pages for you. Things like focusing on progress over perfection, knowing that the hard things really are worth it, and making sure that you take time for yourself. So save these pages for a tough day during nursing school and pull them back out when you need it most, because there really is some great advice and tips for you here. Then we've got 2 different study templates specific to nursing school for you. So I really like starting with exactly what the disease process is at the top and then diving straight into the pathophysiology. Understanding what is going on behind the scenes in the body really sets up the foundation for everything else. And it will lead you right into what the signs and symptoms of the disorder are. From there, you'll want to go down and fill out risk factors, labs, interventions, complications, and of course, client education. Now, for those of you rolling into a clinical semester, you're likely to be asked to do a concept map. So this same sort of note-taking strategy can be applied in this like spider web design where we put the disease in the middle and then we have arrows going out to all the other factors. So save these templates, try studying with them from the get-go, because even if you only do let's say 2 of these templates a week, by the end of the semester, you are going to have a library of notes ready to go in a very testable format. All right, last but not least, we have 3 cheat sheets for you. First and foremost, how to be successful in nursing school, some study techniques to really set you up from day one. Then we have our exam prep and review guide, so you know what to do both before and after you take your nursing school exams. And of course, our test taking toolkit, so you can break down some of those challenging questions and get a handle on what nursing school exams are really like. So I hope all these resources will be useful to you. I remember walking into my first day of nursing school so overwhelmed, and these strategies could have really helped. So if you need these resources just like I did, the link is down below. You can download for free. Feel free to follow along with us at Archer Nursing, and we will be here for you every step of the way throughout your nursing journey. If you want to study with me, you'll get to know me a little, and I always say at the end of our videos, hey, nothing worth it was ever easy. So you're right that nursing school isn't going to be easy. In fact, it's pretty super hard, but it is really, really worth it in the long run. So let's do this together. You've got this. We're cheering you on.